between a speaker starting to speak and naming projective identification for the first time in his talk, and from there you can know the degree of his Kleinianism. The sooner he says projective identification, the more Kleinian he is, right? But certainly projective identification refers to the relation between a container and a content that gets into the container. If it's an element of psychoanalysis, of course, it's as important, let's say, as talking of the unconscious, isn't it? If you talk about the unconscious, you know that you're thinking psychoanalytically. A cognitive behavioral therapist does not have unconscious as part of his tools or his vocabulary. It's not about that, right? And the third one is the positions, the oscillations between the parallel schizoid and depressive position, that is PSD. Now, why is that important? Because we are permanently, according to Klein, oscillating between separating and putting things together. For instance, separating our feelings, right? I love this, but I hate that. I would love to go to sleep, I hate I have to stay awake. I love this woman, but I hate this other one. I love my father, I hate my mother, or I love my mother and I hate my father, right? And that is a way to separate things, to be able to deal with our feelings and our emotions in the world in a simple way. Right? We know the saying, right, that if you want to make things simple, you just classify everything into black and white. There are no grays. Everything is just good or bad, black or white, like, dislike, nothing in between. That makes your life very simple. It's very easy. You find your way. It also makes it terribly flat and poor, isn't it? Because if there's nothing in between, well, that's what you're stuck with then. You are in the parallel schizoid position.
I have a patient I just saw Monday. His father was a very angry man and was very, very strict with him. And my patient is struggling to, and now with his own child. He wants to be a different kind of father. But he said to me the other day, Monday, he said, but it would be so much more simple if I could do it the way my father did. This is the way it is, and that's all.
Exactly. That's simple. That's the parallel schizoid position, right?
Yeah.
If you do what I say, I love you. If you don't, I hate you. There's nothing in between.
Right, exactly.
Right. And the depressive position, which is not really about being depressed, but it's about putting things together and realizing that nothing is as bad as it looks, but it's also not as good as it looks, not even yourself, right? You're not as good as you would like to be. For instance, you can actually have some bad feelings towards someone you love. So you're not just a loving person. You can also be a little bit envious, rivalrous. You may hate your mother at the same time. You can also love her. I mean, it can be both in the mix. And when you realize that, then things do become grayish, right? That it's this and it's also that. It doesn't have to be separate, right? So these are the elements of psychoanalysis that Bion wants us to operate with. And then he says that for an object to be an object of psychoanalysis, meaning for a psychoanalytic therapist that is observing and trying to make sense of what is happening in the mind of a patient when the patient is talking, objects need to have 3 dimensions. You remember, he said, they have to be perceived in the dimension of the senses. That is, the patient is there and that is something that your senses have to perceive. You see, for instance, if you talk of anger, the patient is angry. you know the patient is angry? Well, probably because you saw his face, because you see the way he's sitting, his gestures, his movements or lack of movements, he's tense, right? Because of the way you hear him talk, so it's because of what you see, it's because of what you hear, right? I mean, it has to have some dimension, it has to hit some of your senses to make sure that this is not something that you are falsely making up, that it's just that you believe, right? Intuition certainly is very important for Bion, but he also wanted to alert us that reality exists and that it's not just about saying I intuit, because anybody could claim that anything that you think you intuited, but it may just be you're making it up, right? There is the story about Melanie Klein having a supervisee who said something about a patient and said, and it was then, I felt all confused in my countertransference, meaning that the patient had put that into her, and Melanie Klein said, oh dear, I think this is just your own confusion, not that of your patient. Right? I mean, you could claim that anything that happens to you in the session has been put into you by the patient, but if you don't have any other evidence, you have to wait before you say this is something that the patient caused you. You have to, it has to have some evidence in your senses. If you can say, well, and the patient looked this and this way, right? I did feel confused, but when the patient came in and realized that she was looking around and didn't know what door she had to go into or where she had to sit, well, that would be then that the object, confusion, had a sensory dimension. You saw something that gave you the sense, came from your senses, that something was happening to the patient. And then you felt all confused, let's say, and then you can say, well, she looked like that, and at the end of the session I was left like that. I didn't know where to go. So there is something, some object called confusion that came in. But Bion says it also has to have a dimension in the realm of the myths. And we will talk about that now in row C, that's the row of myth, right? Meaning that we would have to be able to put that together in some form of a narrative, right? If the patient is confused, it would have to have some narrative. Confused like what? Like whom? The patient would have to perhaps provide some little story or some dream or some material that helps us put something together in which the object, confusion, has some place, right? Suppose that, well, for instance, the myth of the Minotaur, right, gives some substance to something that we could call confusion. Someone was supposed to get into the labyrinth to kill this animal that nobody had seen, right? And the labyrinth is an example of confusion. You have to get through that. When we work with patients, in some way we are left to go through the labyrinth, through moments of confusion and sometimes long periods of confusion before we are able to see the animal, right, that is hiding in the unconscious of the patient, in order to unveil that and to put our finger on what is happening. And then ultimately, in the dimension of the passions, and the passions are L, H, and K, right, love, hate, and knowledge. You see, some feeling of some passion.
Having to do with a link.
Having to do with the link, exactly, right?
Has to have that.
Right, if the patient is confused, we would have to know confused of what between what in relation to what. It's not just in the air, right? It's not an abstract. It's a feeling of being confused between objects, being confused among many objects, being confused about his relation to himself. I mean, something, right? Saying to a patient only, you are confused, would not shed much light on something except that, and now we can go to the grid, right? Suppose that you make that statement, you say to the patient, you are confused. Where would you classify that statement of yours? Let us talk of the vertical axis, exactly, the vertical axis. No, yes, the horizontal axis I meant. You are confused.
A definitory hypothesis, you're defining something and saying what it is.
Exactly, you define the hypothesis, you make a definition, you say, I'm listening to you and my hypothesis is that you are confused, period. It doesn't yet say anything about anything other than putting your finger on something that you perceive as an emotion, confusion, and giving it a name. The name that you, the observer, give is confusion. Right? All right. Let us stop there for a minute. So these are the elements of psychoanalysis, right? Now, going to the grid, and I think Blandoni doesn't make full justice to the grid. I always thought that the grid is not only a tool that Bion gave us to operate in, or rather after the sessions, in order to try to classify where we were and what was happening with the patient, but that it's also an attempt to make a diagram of how our minds work all the time, at the different degrees of operating with thinking. You remember that we said last week that Bion turned around the assertion that thoughts are the result of thinking. Yeah. Right? You probably remember, if you read the footnote, or rather the endnote, that Blandoni talks of a German doctor from the 18th century that said that the brain secretes thoughts just like the glands secrete hormones, right? Mm-hmm. Well, this was actually the paradigm that, and still is, right, that we think, that neurologists think about. You have a brain, and because you have a brain, you produce thoughts. Your brain produces thoughts. Bion turns it around and says, no, I want to say that the thoughts pre-exist the thinker or the thinking apparatus. The thoughts are there in the universe, and they impinge on our minds, stimulating our minds to have to think, to have to operate with thoughts. He calls that thought without a thinker. An example, someone was asking me these days for an example. The law of gravity, right, 9.8 square, I don't know what, I don't remember the formula, right, the force of gravity of the Earth, is a thought that pre-existed Newton. Newton didn't invent it, he discovered it. It was there all along, right? Now, at some point, the fact that that thought, called law of gravity, was there, the evidence of which was that all objects fall down to earth and not the other way around, they don't go up, they go down, required a Newton to think about what on earth is happening. Why? I mean, no one before him operated with that thought that was there long before